I had a patient come in once for a routine visit. They're coming for their cleaning and just an exam. But before they saw me, they asked if they could just get the cleaning and skip the exam. And in the back of my head, I was like, dude, why wouldn't you want an exam? I mean, everyone gets an exam at a dental appointment. You always get your cleaning, and then I come in and I do my exam. And it turns out this patient didn't have insurance, and he didn't think it was worth it to pay for an exam. So that put me in a tough spot, and I ended up just saying, dude, let me just take a look. I won't charge you anything. I just want to see what's going on. But as I was doing my exam, I realized that this could really seem like a scam to a lot of people. I mean, the dentist comes in for about 5 minutes and they do a really quick exam and they're charging an extra 50 or so bucks for the person. I mean, do you really need an exam? The hygienist already saw all your teeth doing the cleaning. Hey guys, my name is Amanpreet Singh and I'm the founder of Dental Secrets. While we're talking about exams, why don't you go ahead and examine that subscribe and like button and hit both of those for me. Okay, sir, your cleaning's all done. Now the doctor's gonna come in and do their exam. Okay, let's see what we got here. Wow, everything looks really good. Did you have a good weekend? No? Okay, I'll see you in 6 months. By the way, that's gonna be an extra 50 bucks. Okay, that may be a little exaggerated, like a teeny bit. Okay, maybe not at all, whatever. But the truth is, if you're a good patient, you're brushing, you're flossing, you're coming every 6 months, you have a really good diet, you're wearing a retainer, you have really nice white straight teeth, and I can't find a single thing wrong with them, then chances are your exam is gonna look something like that. Dude, your teeth are literally perfect. How did you get these? The reality is you just don't have any needs, and that's a good thing. So is it worth it to take all the x-rays and to pay an extra fee for the dentist to come in and take a look and tell you everything's gonna be fine? Well, what if everything's not fine? I didn't think about that. Just because everything feels fine, it doesn't mean everything is fine. Something could still be going on. Exams are meant to be preventative. They're meant to be done every year. This way you can take any measures early on and prevent getting treatment down the road. So what exactly does a dentist look for during an exam? So every dentist is different and they have their own way of approaching an exam. So I'm just gonna tell you what I do during my exams. I'll start by coming in, and if you're a new patient, I'll introduce myself. And from there, I'll ask you if you have any questions or concerns about your teeth or any goals that you have. And from there, I'll look at all your x-rays. And here I'll be looking at a lot of different things. I'll be looking at all your teeth, and I'll be checking if there's any signs of infections or any cavity that's starting to form. And I'll also be evaluating your bone level and see the health of your bone and see if you have any potential bone loss or something like that. And this can be a sign that you have some severe gum disease or something else going on. And I'll also be checking if there's any tartar or calculus buildup in between your teeth. And this is basically when there's a buildup of bacteria and it's gotten so hard that you cannot remove it at home anymore. And this is also why you have to come to the dentist every 6 months to get your cleaning, to clean off all this tartar that's building up. This tartar buildup can also contribute to that gum disease and bone loss that we were talking about before. After I look at your x-rays, I'll look inside your mouth. And the first thing I'll do here is an oral cancer screening. This is basically where I look all around your mouth and see any signs of oral cancer. And after that, I'll check the health of your gums. And here I'll be checking if there's any inflammation that's happening or any deep pockets that we could improve on with your oral care at home. And I'll check all your teeth again because I've already seen them on the x-rays. Now I want to see them physically with my own eyes. Because sometimes you can only see a cavity on an x-ray and sometimes you can only see it in the mouth. So you have to check both. And I'm not only checking for cavities here, I'm also checking for signs of erosion, or basically if you're having a lot of acidic foods, or if you have acid reflux or GERD, where more acidic environments are in your mouth, there could be signs of erosion or some wear on your teeth. I'm also checking for signs of chipping or grinding or any wear on your teeth. And this could be a sign that you're grinding or clenching your teeth while you're sleeping. And it may not be a problem now, but give it some time and you could get some jaw pain, some headaches, or even some chipping or cracking of your teeth. And I'm also checking if you have any old fillings in your mouth. Maybe they're wearing down and it's time for a crown. There's all sorts of stuff I'm checking during an exam, and every patient's different. Now wait, hold on. You're telling me you check for all that in just 5 minutes? Yeah, sounds about right. When you do so many exams every single day, you learn to be pretty fast. And every patient's different. Sometimes patients need a lot more treatment planning, so they take a lot longer. And sometimes patients are a lot quicker because they just don't have any needs. And also, we get a lot of help from our hygienist as well. A lot of times the hygienist is the one doing most of the exam. When they're cleaning your teeth, they're also looking at all your gums and all your teeth in the process. And they can kind of see what's going on and let the dentist know what they see beforehand. This way the dentist is going in and already kind of expecting what to see. But let's say you've been going to the dentist for 20 or something years, and every single time it's the same spiel. Oh, you gotta brush more, you gotta floss more, you gotta stop eating so much sugar, blah, blah, blah. I would say it's still worth it to get everything looked at. A lot of times you don't know when something's wrong until it's really bad. And in my opinion, the risks of not getting an exam and possibly missing something outweigh the risks of spending too much money and hearing that nothing's wrong. What if you can prevent your tooth from breaking? Or what if you can prevent even getting a filling? Or what if you can detect early signs of oral cancer? I mean, it's a no-brainer. Get your exams, folks. Thank you guys for watching. I hope you liked that video. If there's any questions you had or anything else you wanted me to talk about, please let me know in the comment section below. And as always, if you haven't already, please hit the thumbs up button and subscribe to my channel below. I'll see you in the next video.